This is Sarnia Lambton Daily for Monday, April 13th. Good evening, I'm Terry Doyle. We begin our show tonight by giving you an update on where Sarnia Lambton stands in regards to COVID-19 cases. As of this morning, the region had a total of 118 positive cases of COVID-19 since the pandemic began. While 10 people have died as a result of the virus, the number of people who are considered to be recovered has increased to 20. In total, 788 people have been tested for COVID-19 in Sarnia Lambton, with 526 coming back negative. There are 144 tests where the results are still pending. At Blue Water Health, there are currently 25 patients admitted who have tested positive. This number has been on a slight decline over recent days. At the end of last week, there were 28 positive cases of COVID-19 at Blue Water Health. There are also 9 current patients who are suspected to have COVID-19 or are awaiting test results. Meantime, Premier Doug Ford with some strong words today about testing in the province. He wants to see the number of tests completed and processed daily continue to increase.
I think we're just slightly under 6,000 yesterday. Our goal is to hit 8,000 by the 15th of April. They're telling me they're on target, and it's not from a lack of anything. We have everything in place. It's frustrating. That's what I can tell you. Very frustrating. You have to understand, and the people at home, we have to separate the elected officials versus chief medical officer, kind of a standalone area. And I've always said I'm not a medical doctor, but it doesn't take a rocket scientist to figure out the more people we test, the quicker we're going to put an end to this. And Brian, if you're asking if I'm frustrated, I'm frustrated, to say the least. But I have to rely on the medical professionals. And again, I'm not a doctor, and we have everything. We have everything available that we need to get these tests done.
The Premier was also asked today whether increased testing of seniors, residents of long-term care facilities, and healthcare workers could lead to restrictions in the province being lifted for other people.
Until we get the green light from the chief medical officer to start moving forward. I heard the example of Ottawa over the weekend by one of my ministers saying there's 3 people in ICU in all of Ottawa, and you're shutting down all of Ottawa. But you just can't flick the lights on. We just can't flick it on, open the gates, and just start. We just can't. We aren't ready yet until we see some modeling that the curve goes down. Then we do trickles opposed to just opening things up. But I hear it. I hear what you're saying. When we go out there and they do some focus polling, and they ask people, the number one concern over the virus, over anything, is the economy with people. They want to find out how they're going to put food on the table, how they're going to pay rent, how they're going to pay a mortgage. That's their number one by far over anything.
Back at the local level, and communities across Sarnia Lambton have been working together to help people get through the pandemic. Let's check in now with the Mayor of St Clair Township. Steve Arnold joins me now with his fancy background. Mayor Arnold, you must be getting more and more familiar with Zoom these days.
Well, I must admit, Terry, I did have help.
Hey, at least you can have a little fun right now, and that looks like a place we'd all want to be right now. How are things downriver right now?
Well, it's like everybody else. There's a lot of people concerned, of course, but there's a lot of hope. The cases aren't that many in our municipality, of course, through Lambton County. That's where we see everything reported through them. Looks like the cases went up 3 on the weekend, and no new deaths. So that's really, really positive. And when I look and comparing us to even St. Clair County or all of Michigan, we're just fractions, of course, of what those poor folks are going through over there.
Now, your area, of course, you get sort of Corunna, for example, which, they don't want to necessarily be called urban, but it is more of a city or community feel versus the rural areas. And is that a bit of a challenge where, obviously, you talk about isolation and people wanting to, not feel isolated, but I've got to think in rural areas, that can be even more of a challenge.
Well, it is a challenge for all of us. I'm in a little village, and I'm on the outskirts, but really, other than going to some of the COVID meetings that we've had at the township, I've been pretty well stand pat, about 3 or 4 different grocery trips in the last 6 weeks. So We started doing this after Good Roads. A lot of us were quite concerned what we saw going on across the ocean, and we know, of course, that international travel, and then things started to kind of come part of the seams in early March across in the United States as well, and a little wee bit in Canada. And so, yeah, it's different. It's tougher out in the rural area, but you know, one thing always to keep in mind, most of the folks that live in the rural part of the county are usually used to this type of behavior. They don't go to town every day. Most folks don't. There's activities that our children are involved with. I think that's the toughest thing, because the kids are used to going to school every day. Some of the folks that aren't working now, that they're used to going to work on a regular basis, and that's a little more difficult. But you know, some of us, we're looking at it as an extended vacation at this point.
Hey, you got to look at a positive spin on it no matter what you do. And I know, knowing you, you definitely can always find the positive in things. One of the positives, of course, of St. Clair Township, 12 months a year is the beautiful waterfront area along the river. Has that been a bit of a challenge, maybe a little bit, where it's a lot of times people coming in from other areas wanting to use that as a hangout spot? And obviously right now telling people, no, now's not the time to be creating hangout and gathering spots. Let's stay close together in your own homes and then wait till this gets better. But has there been any concerns down there about sort of the waterfront area when it comes to kind of the hangout spots?
We didn't have any complaints except for around playground equipment. There were some people that weren't treating it the way that folks thought they should. The gathering, it's been very, very good. I went out of the house yesterday, which was the first time. I just went for a drive down along the riverfront. I saw tons of social distancing, not a lot of people hanging around anywhere. There was only maybe a half a dozen vehicles along the parkway, which, you know, that's not unusual. It was Easter and people were staying close to home. But, you know, we've never done anything to close the trails or the boat launches or anything like that. And we did that on purpose. We want to make sure that people have an opportunity to get out and do some walking, because there's nothing worse than people all crowded into one house and no place to go. So as long as people maintain that social distancing, we've been assured by the province that they're not going to legislate anything. But if people start to congregate and don't know enough to stay apart from each other, then there's going to be further regulations put down. And we'll probably hear a little more of an update today. I think Premier's on in a little bit, and he'll give us more information, of course.
Now, on the other side of that, I'm sure you've heard many stories of people coming together, helping their neighbors, and helping their seniors, for example, with groceries. But I've got to think it's the one thing you've heard is a lot of good news stories in St. Clair Township.
Yeah, we've been really pleased. We have the group in the north, like you interviewed Tracy last week. We also have a real strong group down in the Port Lambton area, the Port Lambton community, and we've had a lot of cooperation from the couple of grocery stores, one in Cronin, of course, and one in Port Lambton, and they're making sure that the groceries get delivered. I know that the struggle is to drop them off and make sure everybody's okay. And and to stay at arm's length and not want to just give everybody a hug, because, you know, during this time, that's what we do. As human beings, we have that closeness and connection. And I know that's a struggle for all the folks that are working on this project, or these couple of projects. We also have Meals on Wheels is still active, I believe, out of Wyoming, and that services all the counties. So I think that's another thing. We have them on the website, their phone number. And so that's another option for people for prepared food. And my understanding from Bill was that they were doing it exactly the same way. Everything was at arm's length and dealing with it that way. And I haven't heard that that's changed yet, but I haven't talked to them for a couple of weeks. So you know, there's some positive options out there for the folks. And I think the biggest thing is the kids, is try and keep them occupied without driving themselves crazy.
Well, you talk about Meals on Wheels. We're going to hear from Bill Yurchuk from Lambton Elderly Outreach later on in today's show, so we'll get an update on that as well. What's your day like? I assume a couple conference calls, playing around with Zoom backgrounds, what you can get for your Zoom background. What's a day during a pandemic like for Steve Arnold?
Well, you know, one of the things I do is I watch stats pretty close as far as what's going on locally, as well as next door in Michigan, especially, and Middlesex County down in Essex. And you know, those types of things are what I get interested in, and just see how things are unfolding, whether the plateau has reached and things are starting to slide down. And that's what I'm waiting for. As far as for me, I went out yesterday and finished up my flag with my ribbon in the middle of the maple leaf. And I wanted to do that to show support for all our first responders. And I came across one of the election sticks I had, and made that into my holder for that. And I got that out on the front of the house now. And, just little things like that. But most of it's still reading. I still have legislation to go through. As you said, we still have our meetings that we're doing on a conference call and stuff. And so you just stay busy. There's always lots to do.
You touched on the first responders. We saw, the St Clair Township fire over the weekend had to deal with a house fire, but just in general, the great work they do 12 months a year, but I'm sure even now putting themselves in the thick of things when everyone else is trying to be safe at home, they've got to run out there, and I'm sure that's something we all respect, and I'm sure you certainly pass that along to all your colleagues down there and the people in St Clair and throughout Lambton County that are the first responders that have been very busy.
Absolutely. They're wonderful people, and the men and women that are involved, and the police, the fire, our paramedics, the hospital workers, all those people in the supply chain that make it work, and even the folks in the grocery stores and those that are trying to make this easier for all of us. And you can't say enough about them, because each one of them are putting themselves on the line day after day, and they do it out of a sense of heartfelt duty towards all of us. And how can you ever say enough in regards to people like that?
Well, St. Clair Township Mayor Steve Arnold, we appreciate the time. We'll let you get back to experimenting with Zoom backgrounds, and we'll keep in touch.
So just so you know, that's Manitoulin Island at daybreak, and that was last summer on vacation. That's behind me. So, and I wish that I could turn back the hands of time before all this stuff went and was there. So it's been an experience, Terry, and thank you so much for giving me the opportunity to have a little chat.
Well, absolutely. And of course, hey, positive there that before you know it, you'll be able to get back out there and do a little more vacationing and touring around in no time, I'm sure.
Oh, for sure. Thank you very much, sir.
Thanks, Steve. That's Steve Arnold, Mayor of St. Clair Township. More to come. You're watching Sarnia Lambton Daily on your TV. Welcome back to Sarnia Lambton Daily. As we've done throughout the program here, as we're into our fourth week of Sarnia Lambton Daily, we check in with various agencies throughout Lambton County to see how they are doing and what's new and what is going on. And Bill Yurchuk is here from Lambton Elderly Outreach. And Bill, you were on our first show a few weeks ago, so we thought we'd check back in. In general, how are things going over the course of the pandemic when it comes to Lambton Elderly Outreach?
Well, going as well to be expected. Thanks for having me again, Terry. We're still very busy doing essential transportation services. That's changed in the sense that, not really changed for Lambton, but we've provided service or offering service to Chatham Kent, as well, of course, the First Nation communities if they require some assistance. London Health Sciences Centre in London, of course, the hospitals there have reached out to us now looking to help with their renal program, so people going to dialysis from other areas. I've learned that Lambton Elderly Outreach is the only person or the only agency who will transport COVID positive patients in Erie, St. Clair, and also Southwestern Ontario. So we're pretty fortunate and happy that we can help.
And I've got to think that's got to be rewarding that these people have reached out, knowing obviously the reputation of the organization and also knowing that measures have been taken to ensure that proper physical distancing and that everyone can stay safe.
It is. We provided our drivers as well as our personal support workers with all the necessary training with regards to personal protective equipment, PPE, and giving them that training. We're exercising, physical distancing as much as we can, and they're just being safe. And we just felt as an organization that at a time when the communities need us the most, we should be here. And so we've chosen to remain active and remain in essential service as opposed to suspending.
And has that been the challenge where maybe some other outlets that people had are not available right now or have not been available, and that's where your organization has been able to fill in?
I think so, yeah. Just quite literally some other organizations and agencies have decided not to transport during this time, or some have decided not to transport anyone COVID positive. And, I certainly understand, I guess, their position. We've just chosen to just be there for the community and keep our people safe as we can through personal protective equipment.
We heard from Mayor Steve Arnold from St. Clair Township in our last segment. He brought up you and brought up, of course, the Meals on Wheels program, and that's, I'm sure, one of those critical programs when you talk about people, in a situation, maybe staying at home, being isolated, and obviously some people are like that anytime, but I've got to think that's a program that the demand for that has certainly not wavered by any means because of the situation people are in right now.
That's true. It's in fact increased quite a bit, Terry, and I'm sure like Red Cross, they take care of the land or the city, Sarnia proper, and we take care of all of the county. We really partner together, and I'm sure their numbers are higher as well. That's definitely a place where it's grown. We've received some donations specifically for Meals on Wheels. One being from one of our city councilors actually in town, and the other being we received $5,000 from United Way from their Compassion Fund, which we're greatly appreciative of, which we could use for Meals on Wheels, transportation, essentially any of our essential services that we can use. And we're trying to put that money right back to the community, whether it's, assisting with costs of meals or fees for transportation. Of course, we can't do everything for free, but donations like this certainly help for those who are most vulnerable.
How does the Meals on Wheels program work in terms of, right now, especially when it comes to physical distancing and making sure that the drivers and everyone are safe, but ensuring that the program is able to continue?
Most of it's to the door, so we will notify the client either by phone ahead of time, or we'll literally knock on the door, almost a nicky nine door, if you will, and we'll leave it on the front, step or whatever their situation is. For some clients who are quite vulnerable and perhaps they couldn't lift them or they can't put them away themselves just due to the weight to them or their physical ability, we're asking them to distance themselves in their home or in their apartment, perhaps go into a bedroom or into the washroom or something. And then our staff or volunteers will, enter the home, put them away, make sure that, they're cleaned off properly and then leave, and then the client would be safe to come out. But most of it is just at the front door.
How are the staff and volunteers doing right now? I'm sure it's a busy time, and of course some people can be sometimes a little nervous, I guess, with the situation they're dealing with, but is that where information and training has come in huge?
It is, and I really, take my hat off to my staff and the volunteers that really stepped up big time. Of course, our community couldn't do this, without people like that, all frontline workers, whether they're in the hospital or CMHC or with us, the End of the Good Shepherd, wherever they are. And, of course, they have their own fears and their own anxieties, but I think they're just truly understanding why they do what they do for a living, and they're just stepping up, and it's just such amazing to watch.
You talked about, before we went on air, you've been doing some work with the Inn of the Good Shepherd, sort of two agencies, working together.
Yeah, so the County of Lambton partnered with the Inn of the Good Shepherd to help extract some of the people who live at the lodge, for example, that may be a little more vulnerable or might even be showing symptoms, and putting them into isolated areas. Of course, as you can appreciate, some place like the Inn or River City, it's very difficult to have social or physical distancing in places like that. So the county partnered, and they're bringing people away from those homes, put them into isolated areas where they're safer. And we're providing transportation to do that, as well as we're providing those residents with Meals on Wheels, so they'll be, eating properly and properly taken care of that way. And also with the Inn of the Good Shepherd, they do meal boxes or food boxes, and we're helping deliver some of them as well, as the Red Cross has decreased some of that delivery, and they can't keep up to the demand, so we're helping out and partnering with them.
Over these past few weeks, what have you found have been any challenges you faced?
Well, I think within the healthcare system, one of the big challenges is to get PPE, personal protective equipment. Of course, it's such a demand across the world, literally, and it's very difficult for us to get that. So we're getting, guidelines from Ontario Health as to, how to steward, proper PPE stewardship and how to conserve it and use it where it's necessary. So that's one of the biggest challenges internally. I think one of the other challenges across the healthcare system is if healthcare workers are getting sick, or at least starting to show signs of, symptoms that they're having to self-isolate for 14 days, that's of course decreasing the amount of health staff available. So I think a lot of that challenge is here, and it'll likely continue.
Have you found with the feedback from your staff and volunteers as well that for some people, whether it is a Meals on Wheels delivery or being transported somewhere, in some cases right now, that might be their only sort of social interactions with people, and I'm sure it's got to bring a smile to their face, at least knowing they have someone they can interact with for even a short period of time and break that isolation a little bit.
It is absolutely, such a rewarding thing for our volunteers to do those types of, deliveries or even phone calls. So a lot of the friendly visiting that's happened in the community, it used to be a face-to-face visit, having a tea and so forth. Most of that has gone to the phone or through, Skype or Zoom like we're doing. but it's still very rewarding. So, and that's why we try not to use the word social distancing. I know it's just a word, but we really don't want to distance people, socially. We just want to do it physically.
And have you found that's, if someone was watching right now that may be, thinking, okay, how can I help out in terms of maybe, is it just a case, hey, if you've got a neighbor or if you've got a relative, just reach out to them, see how they're doing?
Absolutely, absolutely. In fact, there was a street, it was interesting, all the people were sitting on their front porches, all their respective front porches away from each other, and they're all playing bingo. And it's actually quite comical to watch. And, it's just great for the communities to be able to experience some form of social interaction, even withstanding the physical distance requirements.
Exactly. And of course, I'm sure whoever won bingo, they'd be screaming out and making sure the whole neighborhood knew.
Yeah, that's right. In fact, I was reached out by a colleague of mine who, one of the for-profit organizations in Lambton County, and we're actually thinking of putting an online bingo together just to create some socialization. They don't have a lot of things to do. They got some extra time on their hands right now, and we're trying to put that together. So stay tuned for that.
Have a little fun with that. I understand as things go along, there's some needs, though, that Lambton Elderly Outreach has been trying to sort of get the word out on.
There is. We're actually looking to hire 2 registered practical nurses, RPNs, one for supervisor of our PSWs, so they would provide supervision and training in that regard, and another we're partnering with a retirement home that's looking to find a director of care. So we're actually hiring amidst all the layoffs, and that's a good place to be. And us, as well as all agencies, are looking for PSWs and home support workers.
And those are people that we see, anybody that's on the front lines, and your staff must at times interact with those people, and the fact that they're sitting there right on the front lines right now of this has got to be something we all respect.
Definitely respect it. Take hats off to them. They're really doing things where a lot of people wouldn't do, and our system wouldn't operate without them. They're like angels right now, quite literally.
You were also telling me there's, in some cases, been looking for certain kinds of chairs.
Yeah, so when the hospital discharges clients, so we have a program called the Retirement Home Support Program, where we've partnered up with retirement homes. And non-COVID situations, we could, kind of bring people out of the hospital, being discharged from the hospital, who may not have anywhere to go, and we could put them safely into retirement homes. Well, this program is continuing and actually ramping up quite a bit. So one of the needs that we're looking for are armchairs, like living room armchairs, so that we could properly furnish some of these rooms that we're discharging people into. They will get care, of course, but we're just trying to find single beds and living room chairs, so things like that. Dressers, narrow dressers, not the real wide ones that you might have in your bedroom, but say a 4-drawer upright, just some furniture like that. So we've been really fortunate. Some people have reached out and donated some of those over the last few days, but we're still looking for quite a bit more of that.
So if people have some things, and obviously some decent, clean, decent quality, how would they get in touch with you that way?
Yeah, just reach out, to me through social media or through the office. Call Leo, and we'd certainly, make sure that we pick them up using physical distancing, either in the garage or whatever the situation is. So that would be very helpful.
Well, Bill, we appreciate you joining us. Please pass along our best wishes, and kudos to your staff and volunteers and yourself, of course, everyone out there keeping everyone safe, but at the same time providing a much needed service throughout the community.
Thanks very much, Terry. Thanks for doing what you do, bro.
There's Bill Yurchuk, CEO of Lambton Elderly Outreach. More to come on Sarnia Lambton Daily on your TV. Recapping our top story here on Sarnia Lambton Daily, the total number of positive cases of COVID-19 in the region now sits at 118, with 10 deaths, and the number of people considered to be recovered has increased to 20. The number of patients at Blue Water Health that are COVID-19 positive has been holding steady in recent days, or even declining slightly. It is hoped continued physical distancing will help push those numbers down moving forward. That's going to do it for Sarnia Lambton Daily for this Monday, April 13th. For all of us here at Your TV, I'm Terry Doyle. We'll see you tomorrow.